You know, doctors want you to get serious about making your health care wishes known before something actually happens. And you can do that by going through advanced care planning with your loved ones. WFMY News 2's Sydney Moore heard from one Greensboro man sharing why the planning process is so very important.
When it comes to music, it's all about finding the right beat.
On her bucket list, at the age of 43 years old, I believe it was, she wanted to learn how to play drums.
That beat.
She was a natural.
Led Susan Wagner to the love of her life.
A mutual friend of ours recommended me, I've been playing drums my entire life, to possibly give her drumming lessons.
Danny and Susan became friends.
Such a loving human being.
Then years later said their I do's in 2015.
We were married for exactly 7 years and 1 month.
Hey, Daddy.
Until the rhythm of their marriage stopped after Susan was diagnosed with lung cancer.
Went to her liver, went to her brain. From the time of diagnosis, she was dead in 2 months and 3 weeks.
A devastating loss for the family. Before Susan's death in June of 2022, the couple started advanced care planning, a process where people document how they'd like to receive care if something life-threatening happens.
Susan insisted, after we purchased our home, that we get our will and testaments, a healthcare power of attorneys, and a living will. And of course, life insurance.
The couple set up those plans long before knowing about Susan's diagnosis.
It is truly a gift to our loved ones.
Elizabeth Golding, a palliative care doctor at Cone Health, supported the couple and encourages others to do advanced care planning.
He never had to think about whether, what Susan would have wanted. And when her cancer got so bad that we knew she was not going to survive, we were able to give her peace.
Along with planning for health care.
You don't want to wait until you're sick.
Dr. Golding and Wagner say keeping your documents updated is just as important.
Because you could have an accident. There's no time.
That certainly is a hard story to listen and to feel all of those things with that family. We just, heard about how the advanced care planning, how important it is to that family and to others. It's more than just documents, though, and we want to kind of help you figure out how to start conversations with friends and family on today's To Your Wellbeing. So we have Dr. Gene Freeman with Cone Health Palliative Care Services. All right, so, when we start with this, when someone would start thinking about advanced care planning, what would or would they not want at the end of life? I think most of us don't even know where to begin.
And so that's something where really it's a combination of putting together things that are important to you as far as your values in conjunction with outlining those so that really it's available to have the healthcare team work in conjunction with what's important to you and the medical reality of whatever your situation is to come to a shared plan to say, how can we move forward based upon all those important things?
All right, is there like an example that you might be able to give, like one example of how you would want something to move forward or how you wouldn't want something to move forward?
A lot of times when I sit down with families and talk with them, it's one of those to say, well, what are the important things? And often the important things can be spending time with family or being out of the hospital or being able to see my grandkids do whatever it is. And so whenever we start with advanced care planning, it always works best to start with what are our goals? What are the things that we're working towards? What's important to us? And after we have those important things, you start to work backwards to say what medical things are likely to get us closer to those goals. If not, it almost feels like you can come to the hospital and you get a menu of here's all the things that we offer at Cone Health and what do you want done? Where I think we really need to start with what's the important thing we're trying to get to. And after we have that, we can work backwards to say how do we best meet that goal in light of the challenges that somebody has with their current medical situation.
All right, and so, this is a really big topic, and so people probably would not know what they would want. They would need to talk with someone who knows the kinds of questions to ask.
And a lot of times that can be helpful. Most of the time, whenever I sit down with a family, though, it's to talk about what are those essential things that make us an individual? What are the important things to me? And then working to say, in light of any chronic illnesses or acute illnesses, how do we focus on those things? You're right, though, it can be something that's very beneficial to have a guide, whether it be a medical provider. There are many resources available, even online now in other areas, to really try and say, how do we process in a very thoughtful way what our next step should be? How do we go about outlining these important things? What are those important questions?
And these sound like a really hard conversation, a hard topic, but you're calling it a gift, and we're going to have you explain why you call it a gift when we come back from our commercial break. We're going to talk about why it's a gift, how you and your family can start talking about those things, and how do you bring it up over the holidays? That's coming up next. And we are back with Cone Health's Dr. Gene Freeman, and we're talking about advanced care plans. So a lot of people would say, I don't even want to talk about that, but your perspective is, oh, it's a gift to your family when you talk about this.
I believe that sincerely. And the reason is, a lot of the times when I sit down with a family that has a loved one with serious illness, the family will tell me, you know, Gene, I really just want to do what it is that my mom or dad or brother or sister or husband, wife, whomever it is, whatever it is they want to do, I want to honor that. And so for families that have had the opportunity to have those conversations and fill out any documents and really have a good understanding, there's a lot of peace a lot of times with those decisions, because it's really just putting forth the plan that their loved one has said is important to them. Where I see families struggle is when I sit down with them and say, well, here's where we are and here's what's going on. And they say, you know, Gene, I really want to do what it is they want me to do. I just don't know what that is.
And sometimes at that point, they can't tell you what it is. I think a lot of people listening to this conversation would think this is for people who are sick, and you're saying, no, this is for every single person.
So the recommendation really is that anybody over the age of 18 have these sorts of documents completed and a plan in place. It is not just for the elderly. It is not just for somebody that's seriously ill. And so the reason is that number one, it outlines that care plan for your family. And number two, it ensures that if a time comes you're not able to advocate for yourself, what it is that's important to you with your medical care is clearly outlined to allow us to follow that plan that you want and set forth.
All right, so we're all going to be together for the holidays, which is a good time to bring something up when everybody's together and everybody can kind of talk about it, but it's a hard conversation to bring up. How do we do that?
So a lot of times it's a matter of looking for those opportunities. Unfortunately, with the human experience, sickness and death, it permeates our culture just because it's a big part of us as people. And so things like television shows, movies, articles in the newspaper, opportunities like this to sit down and see on the news broadcast about some sort of a advanced care planning thing really can lead to a segue to say, gosh, what is it you'd want in that situation? Some of the other things that can be helpful as well is if you go to the doctor's office, a lot of times on that little piece of paper they give you at the end, it'll say something about advanced care planning. So just as you're looking through that with your loved one, say, it says down here about this advanced care planning. Is that something that you've ever thought about? Maybe we should talk a little bit more about that as well.
I wonder if it would also help, like saying, well, I would want such and such. What would you want too, right? Because it's always like seems to be geared to the person who's older.
Absolutely. And it's actually, that's been very well shown that a great way to engage in those difficult conversations is to be vulnerable up front and to say, you know, if there were ever a situation, here's what I want as far as my care goes. What are your thoughts on that?
Mm-hmm. Yeah. Okay. What about if the person doesn't want to talk about it at all?
So that's something where, as you mentioned yourself, sometimes sharing what your feelings and thoughts are can open that conversation. If not, if it's specifically about talking about being sick and dying, sometimes just talking about things that you value is a very helpful conversation to really have that in the back of our minds whenever we're trying to apply those values to medical care. Something else that can also be helpful is planting seeds. So if somebody's not really at a point where they're open to a full conversation, say, I know it can be scary to think about being sick, but I think it's important. Is that something you could think about? And maybe we can come back about and talk that at some point later in the future.
Mm-hmm, for sure. All right, so is having this conversation enough, or do you have to have the documents, or which one is more important than the other?
I think they actually go very well hand in hand. And the reason for that is that that gives the best picture. The documents can outline, here's things I would and would not want. Discussions with family can outline values, because when you sit down and do any sort of paperwork, you can't really outline, here's every single medical thing that could happen. And so by having that documentation in conjunction with those conversations, it really can help your loved one sit down with the medical provider to say, where we are now, in light of the medical situation, in light of the things that your family values, how do we work together to make that the best plan moving forward for them?
All right, we got just over a minute. So my last couple questions are, where do we find these documents that need to be completed, and then what do we do?
So the couple of things with that are, number one, you can talk to your primary care provider about these sorts of things. Always a great resource. The other place is that Cone Health actually has a website set up. I had nothing to do with this, so I cannot claim credit, but it's a great resource. And that's conehealth.com/advanced care. Forms are available. Also has just kind of a walkthrough on how to go about completing those, other things to think about. So really a great resource available there.
All right, tell me one more time what that web address is for that document.
Sure thing. conehealth.com/advanced care.
Okay. All right. So thank you so much, Dr. Freeman, for kind of like laying all of this out and being so patient with us with all of these questions. We want to make sure that you get a full recap from today's Q&A on WFMYnews2.com, and you can get your questions answered. You can talk with your family about it. It's just a few minutes. We'll have it on our website. You'll click in the To Your Wellbeing section.